Good afternoon. My name is Carolyn Dubé. I want to welcome you all here this afternoon. I'm the Executive Director with Fertility Matters Canada. We are the national patient organization that provides information, education, support services, and advocacy for those Canadians who are struggling to build their families. And I'm thrilled to be with you today with two of my very favorite reproductive endocrinologists in this country, Dr. Marjorie Dixon from Anova Fertility and Dr. Jason Hitkari from Olive Fertility in Vancouver. Both are former board members of Fertility Matters Canada, so they are very strong advocates for patient care. And I'm thrilled that they're going to be able to talk to us this afternoon about what they've been learning because their clinics have been open. And I'm excited to learn a little bit from Dr. Hitkari, Jason, because his clinic's been open for a few more weeks than Marjorie's clinic has been open. And it'll be interesting to see if things are different on the West Coast than they are in Central Canada. So I'm really excited. So Marjorie, why don't we start with you? I'd love for you to say hi, introduce yourself, tell us about yourself, and then we'll jump over to Jason.
Okay, well, thank you so much, Carolyn, for having me as one of your panelists. And so I am Marjorie Dixon, or Dr. Dixon, and I'm the CEO and Medical Director of Anova Fertility and Reproductive Health in Toronto. And so I have been very involved in this whole managing fertility care through this COVID time, both on the national level with other medical directors, but also locally in the province, and just having a very careful approach, understanding this balance that we have between the social responsibility and then getting our patients back to care and advocating for the TTC community. So I think that's pretty much wonderful. What we could say about me.
Yeah, Jason?
Hi, everyone. I'm Jason Hitkari, and I work at Olive Fertility Centre in Vancouver. Yeah, it's been a very, I think, different world here in BC, what with things not being as severe with COVID. And as you said in the introduction, Carolyn, we've been kind of up and running, I think, a little longer than most places. But still also, it was quite an ordeal to go through the closure and then try to understand when and how we were actually going to bring care back to patients. And in general, it's going very well. And it'll be interesting to kind of talk about some of these details and how it affects the patient experience through working at a fertility clinic.
Absolutely. This is your post-pandemic fertility journey, and I'm really excited to sort of walk our patients through that. I must mention that this webinar series, this is the third in the series that we've been doing, is brought to you and to the patients and to everybody else watching by the generous support of EMD Serono. They are incredibly supportive of our work and the patient work, and feel very strongly about having this information get back to patients. So thank you to EMD for your continued support in this. We're going to start today. We're going to engage some of the viewers. We've got some poll questions. We're going to ask 3 questions just to get started. And I'm hoping that they may pull some conversation. We're going to get some feelings. So the first question is going to pop on the screen, and you can just touch the screen if you're a patient watching this this webinar. We're wondering if your fertility treatment has been interrupted or altered due to COVID-19. So some people have had canceled cycles. Some people watching may not have had any interruption at all. Some people may have been looking to get into clinic. So we're going to actually get some live data once everybody answers the question. Just takes a second there. There we go. All right. So we've had 74% of viewers have had a treatment cycle canceled, and 11% had no interruption at all. So that's great. So the majority of people watching are here because they want to learn about what's happening to their treatment now that things are back open. Okay, next question. Do you feel ready to resume or to start treatment at this time? So this is something I think that's really important. In our last webinar, our respondents felt that they could have used some more social supports during the pandemic while the clinics were closed. So it'll be interesting to see if patients are feeling ready or if there's some tentative feelings there. Yes, 90%.
Wow.
Well,
Wow.
that makes me feel
Wow.
wonderful. I bet you there's a lot of people out there that are feeling anxious to get the ball rolling.
Yeah, totally.
Yeah, I'm not
Marjorie
surprised.
and Jason, do you feel is that
Yeah.
you find that that's what you're seeing with your patients?
Pretty much.
Absolutely. Yeah, I'm not surprised by that answer at all, because we were essentially closed in total for somewhere between 6 to 8 weeks. And during that time, we certainly heard from our patients. You know, we did complete, if they were doing IVF, we did complete their IVF cycle. So we didn't leave anybody kind of hanging mid-treatment. But those people just about to start or had visions of starting during that time, we didn't. And we heard from them, and they were really distressed by that and bothered by that. And so I'm not at all surprised that people are anxious and feel, wanting to get going. Yeah.
That's great. Marjorie?
I would agree. Yeah, I would agree. I think it's been an evolution. When it first happened in March, we were closed for a little bit longer. So it was a total of 8 weeks. And initially people were upset because, it's one thing to have your fertility journey, which is a roller coaster on a good day. And then you finally get yourself together and organized to start your cycle. You've signed your consent forms, you're ready to start, you have your medications, and to be told then you have to stop. And then what happens to the rest of the medications? Are you going to be refunded? People were stressed out by it. And then we started to see people electronically. And so the initial feedback was like, okay, so I don't want to do anything. I get that you're doing this. It shouldn't last more than a few weeks. And as it progressed through the time, it got longer and longer. We were waiting for this curve to flatten. And that uncertainty added a level of angst to patients that we could never have anticipated. That has now changed. So you have this, oh my God, this happened. I'm angry. Then I have the fear. I'm not sure what I need to do. And now coming out like, okay, now the curves are flattening in different places. We kind of understand what this is. We've been told it's safe to get pregnant again. I'm anxious to get back. That start me up. When I start yesterday, that's what I'm getting now in the interview.
Yeah, definitely.
So
that's well said.
Either.
That's awesome. Yeah. And that's great for patients, because I'm thrilled to hear that people are feeling ready to get going. We've got one last poll question. How do you feel about the measures your clinic has taken in order to protect patients and healthcare workers against COVID-19? We asked this question because we're curious to know if patients feel they need more information before they get going in their treatment cycles, or if there's more that we can do as an organization, for example, to provide them those supports outside of the clinic. Satisfied. 83% feel satisfied. There's no one watching that feels unsatisfied. Canadian fertility clinics, thank you for helping our patients. What a lovely result to see. Marjorie and Jason, you must feel thrilled with that.
Yeah, because it was actually, it felt curiously like almost apocalyptic, that we were talking about PPE, and then we had to have the barriers, and then we had to screen people, we had to do the thermometer, we wanted to protect our staff and having shifts so people, if someone got infected, the other people would be safe, and doing everything that we can to be virtual. Jason, I don't actually know how BC got you back, but for us in Ontario, we were fortunate enough to be entered into phase 1 of reopening. So after the province was closed for such a long time, we were reopened, but Public Health Ontario and Toronto Public Health were very specific in as much as the measures that needed to be taken in order to be conformed to the regulations to keep Ontarians safe. And they were extensive. And then there was the second piece of that, which is, okay, we're not supposed to be back full tilt. So we're back to business, but we're not at the same volume. And we have to be cognizant of the limitations of the not knowing where this is going. So we are happy to be back, but we are still very conscious of we could have another wave, and we don't want that to happen in a fertility clinic, right? So I don't know.
I mean, I think that, again, I'm not surprised by that answer in a way, because clinic directors and managers were very earnest about looking at what we need to do to open safely. And as Marjorie mentioned, like on a national level, that was the case. Clinic directors met and hashed out details and even created a document about how to best open and run. And so people took this, and again, really we are physicians and nurses and healthcare providers, and we understand the importance of doing things safely. And that really came through. I really think people took this, of course, very seriously. I mean, not only in our area, of course, in lots of areas of society, but certainly in infertility. Yeah.
Absolutely. Well, thank you both for commenting on those things. And what I would love to do now, the audience, Dr. Hitkari and Dr. Dixon have both submitted photos from their clinics, because we felt that it's important for patients who haven't gotten back to clinics to kind of see the measures that are being taken, so that when you do get to your clinic, you can kind of see what's happening for both the patients and the staff. And so, Dr. Dixon, if you wouldn't mind, I'd love for you to talk a little bit about some of the safety measures that Anova is doing. And we've got a little bit of a slideshow here of Anova's clinic, and then Jason, we'll pop back to you to talk about all of them.
Okay. So thanks again. So just as Dr. Hitkari was actually explaining, we met as medical directors across Canada, and certain of us came up with draft guidelines that were then disseminated through the CFAS, the Canadian Fertility and Andrology Society. And so this was taking into consideration recommendations from the Centre for Disease Control, the CDC, the ASRM, ASHRI, all of the different places, and in some jurisdictions where they had already had their wave of COVID and were coming out on the other end, we were just entering into ours, right? So we used that information and came up with these guidelines. So we have a two-phase screening process, which means that patients are screened before they get to the clinic. So they have their appointment, but they're screened ahead of time through our telephone system. And then they are again screened at the clinic. So the way our clinic works, we are in a building, a multi-unit building. So we have to screen them downstairs. If they are cleared on that screening process once they're in the building, they receive a mask, and then they can access the clinic, go up to the floor. So there's the pre-screening. We also have extensively consulted to come up with COVID-19 consent forms, because we also recognize that it's going to be important to protect all of the patients from each other, our staff from the patients, and the patients from our staff. So we actually have a consent so that patients understand that, unfortunately, the risk of coming into care during this time is that if you were to exhibit symptoms or signs that would point to you potentially being affected with COVID-19 or at risk of spreading it, that you would not be entering any of the clinic spaces. So we reserve the right to cancel your cycle, sadly. And it pains us. You should know this. We debated extensively about how to manage this, because we want our patients to get to care. We don't want to cancel anybody. It's been enough to be gone through what you went through. But we really have a mandate for safety and the safe delivery of care. So before patients undergo any kind of treatment during this time, we have screening consent forms that they can actually sign electronically through PDF, because again, we're minimizing face-to-face interaction. And then we also have PPE, personal protective equipment. So we have special measures, in as much as everyone has a mask when they come to the clinic. And those are the disposable ones. We are not having people into the clinic with their homemade masks, actually. And then also we have specific protective measures, temperature monitoring. So you might see in one of the pictures where there's a temperature thermometer gauging. I happen to know that my basic body temperature is 36.3 because I get it tested as well every single day. All the physicians coming in. I didn't know that before. We are sanitizing our hands before accessing the clinic. And then we are really continuing with these virtual appointments. So much as I was in clinic this morning doing procedures, I then come back to my home office and I'm seeing patients virtually through the day. Okay, so we're minimizing that. And, you know, everybody is screened. We want to give some comfort to patients so that you know wherever you are in the clinic, because this is an anxiety-provoking time as well. And so we have stickers that vary in color based on the day. So it changes from day to day. So it might be neon green on a day, then blue, and then white. Once you have passed your screening, so you have a physical marker. So whomever you cross, all of the staff all of the patients that have been screened for the day, you can be given comfort that they were screened and they are carrying that. So that also makes patients feel that. We were toying with the idea of putting our picture face on our PPE, because now we're all covered, and I think it's awesome a little bit. Yeah,
We've seen that.
So we're trying to figure out a good way. You have our ID, and sometimes I'm like, this is me. It's really me. But we're figuring that out. But it's important for us to keep everybody else safe in the process. So that's how we're doing it. And then every single appointment that is had is appointmented. People are not dropping in. They're not just calling. Previously, you could just call and be admitted. You cannot access the clinic without a specified appointment, which then means that we can only see a certain number of patients per day. We are not full volume. We're not seeing the same number of retrievals and transfers today. So I want people to really understand that much as we are back, it's not floodgates open. We have been mandated to do this safety, and so it has to be measured and contrived. And so that's why we're encouraging our patients that if you had your care interrupted, or if you, for whatever reason, haven't been to a clinic for a long time, book yourself a virtual appointment and make that plan. Get your ducks in a row, because if you can't get into your case right away, at least you will have an organized plan such that when you were given an appointment time in a safe and measured way, that you understand that you can get to the clinic when you only must be physically there. Okay.
Wonderful.
So I think that's pretty much.
Yeah, that's great. This is really very important, Marjorie. We've got some photos now coming up from your clinic.
Yep.
I'm assuming this one's probably at your front door, in the lobby.
Yeah, so remember I explained that we're in an edifice, and therefore we have the entry. So our screener actually is in the lobby. Okay, that's the building. So this is that thermometer. I said my temperature 36.3. So this is an example. So the person who's doing the screening has on their PPE, and actually we're fortunate enough to have these wandy thermometers, which took some learning to do, but these actually measure your temperature without needing to touch you.
Yeah, that's really important.
And so here you see, this is it's the same weight room that we have for the reception, but you see these plexiglass barriers between the reception staff and the patients, and those were part of what was recommended by Public Health Ontario, and therefore we've added these. Sadly, feels a little bit like a bank, but really we're trying to keep the reception staff protected and the patients from the reception staff. So this is what you'll see now. That's new and different. And the social distancing. So we actually put some physical reminders for patients so that, you know, if you're standing there, the next foot stand is like 2 meters apart, and they serve not only as this is when you stand, but also to remind people, because, you know, we have the hand sanitizer everywhere. If you see it, use it. And then we are trying to respect that physical distancing. In spite of the fact that we have the PPE, we don't want to let our guard down and get comfortable. So we've actually also physically moved chairs from our weight room.
Okay.
I don't know if you have a picture of that. I can't remember.
I think we do, actually. Oh, here's some of your staff.
So that's some of the staff, and you see how they have the PPE and protective equipment wearing. And so I know that it can be off-putting, but I can tell who is there. I know who the people are. But again, we should probably wear a little picture with our faces on it.
Well, it speaks to a big issue, though, you know, which is that as a patient experience, the kind of personalized touch is different now. You know, like we pride ourselves on a kind of patient-centered approach to care, and I know Dr. Dixon, you guys, I'm sure feel this too, because now if you think about it, we're doing, you know, video, you know, consults, so we don't actually get to be with each other. When you come, the person you're seeing is in PPE or a mask, and it's like I think that's a real change in the experience for patients, is that a lot of the personalized touch, it feels different, and it's a real change.
I would have to agree.
Like Jason nailed that one, because that's also feedback that I'm getting. I'm looking at the pictures. I've seen them before, but imagine if you haven't been to the clinic in 3 or 4 months and you show up and it feels, I guess, I say it again, I use the word a lot, but it really does say it, apocalyptic. It's different. It's like one of those movies where people are wearing all this stuff and trying not to get illness, right? So imagine the patient-centered experience that we try to give. It's not the same, but we have no choice, right? And you know, those stickers says completed, so she was screened right there. That's a patient who was screened, and having her bloods drawn.
I can imagine as a patient going through this. I mean, it's a very intimate experience on so many different levels, and when I went through my treatments, you know, it was nice to connect with the nursing staff who you see every day. And, you know, sometimes you needed a hug. And so it's
Oh, there's none
different
of that.
now.
Yeah.
And, you know, I hope it's not like that forever.
Yeah.
But I know how important it is right now that these steps are followed so that we can continue care.
And patients,
Absolutely.
of course, understand that, right? That they understand it. But yeah, it's that subtle change that I think their experience through the process will feel different. Yeah.
Absolutely.
Mhm. So again, you see everybody with their PPE again, and where they are, everybody's wearing their gloves and changing, washing their hands and having their PPE on. And behind plexiglass. Oh no, this is not my clinic anymore.
Now we've flipped.
Yeah,
Yes.
this is my assistant Julia.
Yeah.
Basically, my pictures are very similar. Although I did say Julia's not in a mask, but we actually had no patients here. I just wanted to show you the kind of the plexiglass aspect of things again.
And again, and I would say I would assume maybe I shouldn't assume, but the majority of clinics across this country, so no matter where you're going for your treatment, have put similar measures in place. Would you agree with that?
Yeah, because those are really prescribed. You know, really again from that document that the clinics in Canada put together, really prescribed. That previous slide, I just want to show you that it's not super important, but we sort of move directionality. So now patients, this is our accounting area, and so patients actually move in a direction rather than everybody just kind of going to the counters.
That's really
one
important.
Of the pieces. Yeah. Yeah.
That's a good idea.
Yeah, that's great. And Jason, this is nice. It shows that the distance between the chairs.
I know. It's sad, right? I know. I call it a through room now. It's a through room. It's not a wait room. It's a through room.
That's right. Because with the people at the front, our staff at the front will phone and say, "There's 3 people here now. I mean, we got to get like we don't really where we used to have like 30 patients all, and this is a very sparse, kind of sad looking waiting room now. But yeah, it is to get the distancing, and also little things like being able to wash the chairs, like those they have to sort of be washable. So. And this is our screening center. So we do it as people come off of the elevator and enter into the clinic, and similar Dr. Dixon setup too. Yeah.
Great. Well, thank you so much to the staff at Olive and the staff at Anova for the incredible care you're taking, and all of these pieces that you obviously needed to put into place, but with great care, and the thought that went into this to ensure maximum I was going to say maximum exposure, but maximum unexposure to individuals, and whether it's a patient or a staff member. So thank you.
Well, that's true. It's nicely said, because it was a ton of meetings and very thoughtful, not myself, but very thoughtful people at the clinic who really thought of every detail. And it was quite nice. Yeah.
And I think that's important actually to touch on, that while all of these fertility clinics were closed and while it was quiet for patients, the clinics and the staff, the doctors and the medical teams were not working.
Not quiet. No, it felt like wartime. There was, but what I can say, Jason and I, the community is small, right? So we all know one another. And what I found, I call them COVID blessings. It has been nice to commune with our colleagues. It has been nice to really collaborate for the greater good of our patients and society at large, because we do feel responsible on both ends, right? And so that's been nice to have the touch base with other experts in your field, and use and lean on each other during this time where we all feel isolated, to be honest. We were busy bees. Well, maybe not bees, busy people behind the scenes.
Yeah, so thank you for your attention to that. What I'd love to touch on now, while people were registering for this event, we gave them the option to pick the topic that they really wanted to hear about most. And what came back as the top topic was what the impact of the pandemic will have on treatment outcomes. We'd love to have a conversation about that. Is this something that patients need to be concerned about? We're hearing it in our support groups, maybe not as much now, but really when it was starting, these were the comments and the questions. So I'd love to hear your thoughts on that. Jason, maybe we could start with you.
That's a great question, and actually very few people have asked me that question. I just wanted to just clarify that in BC, I think the clinics are actually kind of essentially running at the capacity we used to previously. So there is no triaging or kind of deciding who gets to go first. And again, honoring, making sure we have set appointments and distancing and things like that. So there isn't really a patient population that's not being able to access fertility care now. And I say that because I think what we worried about affecting outcomes was how long this delay was going to be. Like if we were closed for 6 months or 9 months, that is going to change people's outcomes. And so that was our biggest concern and why we lobbied our provincial governments and public health offices to make sure they knew that, hey, we're here and our patients need us and we need to be available for them. So that was a big issue affecting outcomes. In terms of the lab, and I have no concern at all that our outcomes will be the same. I don't know why they would be different. We have the same people here. We have the same protocols in the lab, the same staff. So while a patient's experience through the clinic, like we've talked about with the PPE and the distancing and things, in terms of outcomes, I don't have any concern. I think they'll be the same.
Yeah, and I would reiterate that. And as much as the outcomes, I can't imagine that they would be any different. We are bringing people back, the same staff, the same processes. We've already written protocols for patients. When I said that we're seeing a lower volume, it's just by virtue of that we have to distance people through the day. Our cycle monitoring hours are actually going longer than we used to have them because we're seeing patients, they have to access the blood work and the ultrasound. And we can't have people waiting in the wait room, and we want there to be minimal person-to-person interaction. So when I said the volumes are lower, it's just that we can't accommodate, unless we were open 24 hours, we had big volumes of patients going through smaller amounts of time. So you can imagine that has made things a little different. But for outcomes, no. And we aren't either prioritizing one person versus the other. It's who was in the schedule and plan to go through, they're going through. Our patients with all of their diagnoses are accessing their care, and that is not just for IVF, but for IUI, for cycle monitoring. So just to make that clear, we are still seeing our patients, just it seems more slow, but we still see, when I'm reviewing bloods, I'm like, look at all those people that came through, and I saw nobody in the wait room, right?
Yeah.
Definitely.
What's interesting, though, I find it's very interesting, is that we used to have, so people who are listening have been through, for example, an IVF cycle. We used to have everybody come in for a blood test and ultrasound in the morning so that they could get their testing done and head off to work. But we can't really do that anymore. We can't have 30 people in a waiting room at a time and so it's spaced out. But what I find is that a lot of people are working from home now, and they are kind of freer in their scheduling. So people don't seem to mind. They say, listen, come in. Why don't you come in at 11:30? And people are like, man, I'm working from home anyways. So it's interesting how people's lives are a little more flexible. I appreciate some people have lost their jobs and things like that. But my point is that people seem like a little more flexible in their working lives. And it makes it actually kind of easier, I think, for a lot of people to get through treatment, honestly.
To jump on that, I was curious to know, this isn't, this is just for my own personal questioning. Do you think that this COVID pandemic and how clinics were forced, and in the medical field probably in general, do you think how you're going to do treatment and is stuff going to change? Is it going to open up access to more patients because of the ability to do some things virtually or remotely?
Yeah, it's interesting. I was actually going to go there because what Jason said tweaked that in my brain as well. So interesting that you went there. But, part of us at Anova and as physicians in general, our mission is access to care, right? And patient-centered approach and access to care. I used to do virtual appointments for patients who were remote in Ontario and patients sometimes through Canada. Now we're employing it for even our local patients. And patients are saying that it's more convenient. They know what time they're going to be doing their appointment. They like it that way. And also, there's something about COVID that has, again, a COVID blessing. It sucks. It's not anything we could have anticipated. It's going to have repercussions for years to come. but it has also made us take a step back and say, you know what, I'm happy to get back to care. I recognize that the way in which care is provided is going to be different. And you know what, maybe I have a more open mind into like, this change can be okay. And it hasn't, I want to validate too that it's been really tough for patients. It's also been tough for our staff, right?
Yeah.
Because we have bombarded them with, okay, so now we were used to doing things this way. This is the way it's going to be. But I want you to remember that patients come first and we have to be available to do X, Y, and Z. So we're going to change our operations here. Oh, wait, that didn't quite work. Let's take a step back and do it. So there's a lot of adjustment that is happening. And in as much as even the medical directors within this province, at least in Ontario, we meet once a week now to talk about, so how did it go with you? And how was your screening going? And what did you find the biggest challenge of the week? So it's been nice to be able to bring our patient-centered care to a broader platform so we can do an even better job of providing the care. So I am hopeful. I know I'm that Pollyanna chick, but I know that there is a silver lining in this, and maybe we'll be able to deliver better care to more people because we had to have this readjust, right?
Jason, would you agree, or?
I think, yeah, for sure. I mean, again, I miss that sitting across from somebody and hearing their story and feeling their energy. And I find it's really hard on a personal note to teach people. I sort of, my approach to seeing patients in consultations to try and help them learn about what might be happening and what's going on, and really try and teach what might be happening. And that's very hard to do even through video. But that being said, not every visit is needs to be a really super complicated visit. And so I think people really appreciate the efficiency of having a quick video chat and saying, I need a refill for this, it's a bit for people's lives rather than having to drive.
Patients probably in bigger centers, Toronto, Vancouver, Calgary, Montreal, where traffic and parking and all of those things that complicate that, it's not as big an issue for, I'm located in Moncton, New Brunswick, so those things aren't as big an issue, but that can add, it just impacts and complicates and compounds the process sometimes. So I'm glad to hear that you think that there may be some efficiencies that patients could anticipate. Great. I'd love to know, just touch on a little bit of the backlogs. I'm curious, I know, Jason, you're back to sort of full capacity or almost full capacity. Is your wait list longer now than it was before, or are you sort of catching up? Or have you caught up?
Yeah, we caught up actually. We usually here at our clinic have about a 4 to 6 month wait list, which is just too long. But because we didn't have much to do as physicians except plan for the reopening and talk to patients in consultation, the wait list went down to probably a month. And
wow,
also,
that's amazing.
We didn't see a lot. We saw a drop in referrals as well because either people were not leaving their houses. They weren't going to see their family doctors to talk about their fertility as much. So you saw a sort of a dip in referrals, and we were just talking to patients all the time. So the wait lists seem to have gone down.
Great. Marjorie, I'd love to know about your wait list. And then I'd also want to touch quickly on specifically the Ontario funding program, because that is a question that was submitted. And what that's going to look like now.
Well, we're fortunate that it's still ongoing. So patients, how it works, at least at Anova, is that we have patients that are signed up on a first come, first served basis. And patients know 3 months ahead of their cycle when they're scheduled for. So it did create a bit of a backlog because patients who were set to begin in the beginning of April or end of March were not able to start. And then we have that pushback of now a full 8 weeks, right? So we are now getting patients back into care, but that did create more of a backlog for funding. So for our patients who were accessing their funded cases, one, there was the worry, am I going to get my case? And we were like, yes, you will get your case. There was funding. And in fact, through the pandemic, we were a center that was still doing fertility preservation for cancer patients. So even though we were fully closed, we would open to do fertility preservation for oncology patients, for example, through the Ontario Fertility Program. So that was one thing that we did offer. But the wait list got pushed back, not just for that, but surgery. So I'm on staff at Sunnybrook Health Sciences Center, and I do my surgeries out of the hospital. Well, my surgery cases got all canceled as well, elective surgery, from the month of March. So while before that I had a wait list for surgery of 6 months, now it's going to be longer. And we're just reopening at the hospital a few emergent surgery days. So I'm not even back to my full volume. So it has impacted in as much as people getting to their care once they have their treatment plan a little bit. But it hasn't, as Jason said, we saw a lot of patients during the pandemic. It's all we could do. So we were doing a lot of patient consultation, organizing their plans, getting their ducks in a row. So we did shorten that down. And also the referral base from family doctors as well, who weren't seeing patients in office, was lesser. So we managed to catch up a bit. So now, like, we're ready for patients to start having their referrals again, to see patients again. So we can do that. And we're still doing it electronically by virtue of what was mandated by our premier in our province, right? So it might be different for different jurisdictions through Canada, not just BC, but Alberta and Manitoba, etc.
Absolutely. I just want to mention for those of you watching that we do have a chat option. So if you have questions for Dr. Hitkari or Dr. Dixon, please feel free to put them in the chat option, and I will get to those today. Sorry, Jason, go ahead.
Oh, sorry. This is a really good point about surgery, you know, because a good proportion of our patients need surgery, and it could be just to remove a polyp in the uterus or something in preparation, like having to do with IVF or not. And that is a real problem because that impacts patients significantly. Even to just have a simple polyp removed here in Vancouver, you were looking at previously 1 to 2 months to get that done, and now it's 6 to 8 months, which again, in terms of outcomes and patient well-being, that's obviously a really long time. That's a huge problem.
Right.
But I should also let people know that right before, I guess maybe 6 months before COVID struck, we started doing operative hysteroscopy at Anova. So we will likely get more patients. So the difference between the hospital and Anova is if you do it at the hospital, you have a general anesthetic. And so for the bigger cases, if you have fibroids that are at risk of bleeding, something that shouldn't be done under conscious sedation, we do at the hospital. And laparoscopies, of course, we have to do at the hospital. But for hysteroscopies, we're fortunate enough to be able to do that on site in our surgery center. We have 3 ORs. So that's been one thing that has proven good for patients. So we can actually funnel patients into the on-site local anesthetic conscious sedation polypectomy, which is a blessing too.
Oh, that's great. Yeah. Are there any differences in what's being offered now? So is everybody, like your full menu of services, for example, fertility related services, is everything being done right now, or was there a period where you're starting with certain procedures and then phasing into others?
We sort of did that for a short period of time. So as we were opening and we were worried about being able to manage the distancing and the patient volumes, and so we said, we are going to do egg retrievals, and so IVF up to the egg retrieval, now, and where we're going to defer, frozen embryo transfers and inseminations until later in the summer. That was our original plan. And then 2 things happened. First is that we realized we could manage the volume patients coming through fine. Secondly, the patients were, again, very distressed. Like, we got a lot of feedback from patients saying, why would you do this and not that? And I've been waiting, just the things we had sort of talked about already. And so because we felt comfortable, we could, have patients come through the clinic. We're sort of back at all our services are available and through this and with the same volume. Yeah.
Great, Marjorie.
Yeah, no, for us, we started a little bit after BC. So when we first came back, we decided to open to all of the things that we do. Of course, we have multiple clinics, so there's several Anovas and Juno clinics. So we didn't open all of the centers all at once. We started with a mothership. I call it a mothership. And then we added in a measured way the different sites once we had everything organized, because we had to organize ourselves differently so that we could predict and manage the flow and the volume of patients. So we simplified protocols. We have like one protocol that we're using for our frozen embryo transfers, for example, in the preparation, unless there are extreme circumstances, we have exceptions. Same for IVF, because we are trying to manage the volume and flow of patients through the clinics. We are actually putting patients on the birth control pill who are eligible. And so we can time them into their cycles in such a way as we deploy them to manage the flow. So it has created a very regimented approach to the deployment of cycles to manage the volume and number of patients per day to have that social distancing. But we're recognizing that the patients also like it because they really know, okay, so I started on this day, this is my stop day, I should be retrieved around this day. And so it's great, you can look at a chart and say, this person, this is where they go, this is the retrieval, this group of people, this Monday, Tuesday, whatever. So when you explain it to the patients, it simplifies things, but it also creates a degree of anticipatory guidance that we might not have happened. We thought we were going to make everybody mad because often when we do stuff as doctors, Jason will see, we have the best of intentions, and sometimes the unintended consequences, patients are like, oh, that doesn't work for us, but this one has. Yeah, so that's
probably a nice thing for patients to say, okay, I know on this day and the 2 or 3 days after, I'm going to be off work, or it's nice for them to be able to plan a little bit in this time of when everything seems to be up in the air. That probably does provide some nice structure to someone's life.
Structure, good word, structure.
That, and also I think it allows you, because we should similarly developed a program to try and predict, it's almost like a spreadsheet, predict sort of the volume of patients that might come through at a certain time, because that affects outcomes, because you don't want to have a huge bump of, like, you want to have a nice steady sort of flow of patients through. But it also allows you to perhaps not defer treatment. Like if you're feeling really overwhelmed, you might say, okay, listen, we can't really start anybody this month. Let's, maybe you'll have to defer your treatment. So by kind of carefully trying to control volumes, you can make sure people get the access when they want and not get these big bumps in procedures that could affect outcomes.
Yeah, that's a great point. That part could affect outcomes if we think about what might. Yeah.
These are excellent conversations. Thank you for talking about that. I think this is still coming up a little bit. The effect of COVID-19 on pregnancy and what that looks like. I know it's still really early, but I'd love to hear what the science is showing and what people are hearing.
You want me to? I'll start. So the experience with the coronaviruses, it was in the beginning when it was all happening, all we had as a point of reference was what had happened previously with SARS and MERS and looking at what had happened to those babies. So from that, we extrapolated because we didn't have any number of pregnancies that were followed. There was no real literature except for some case reports of a few patients. So from that experience, we were worried. And we were worried about IUGR, so intrauterine growth restriction for the babies, or we were worried about miscarriage in the first trimester, and we were worried about the potential for vertical transmission, excuse me, for the transmission from mom to baby and delivery. And then we started looking at groups of evidence of patients that had babies after COVID, through COVID, when they were really spilling a lot of virus, if the mothers were affected. And we weren't seeing the vertical transmission, and we didn't see the miscarriage rates, and there wasn't the issues with the IUGR, for example. So we took a step back and said, well, there isn't evidence for this, and therefore we feel comfortable moving forward with it. Because unlike things like Zika, where we told patients, okay, well, if you travel to this area, we're worried there's no, it can live in the semen for this long, so we don't want to do this, and we don't want you to attempt pregnancy for 2 months, you have to wait. We don't have that with COVID, and we didn't say that to the rest of the population, right? So the maternal fetal medicine specialists, the specialists that do mom and baby medicine and physiology and manage them through pregnancy, as a society came out and said, we don't see evidence in the medical literature to suggest that we should stop all women from getting pregnant during COVID. And therefore, if we're not doing that, we shouldn't extrapolate to fertility centers. And furthermore, there are some fertility centers through the world, through hotspots, that kept moving in their fertility care through the whole thing, right? The main issue was control the spread, manage the curve. Even healthcare providers who were frontline workers who were pregnant were told that they could continue to provide care to patients as long as they practiced some basic infection prevention and control measures, and the babies would be fine. And so that's what we're seeing preliminarily, right? Now, there'll be much more data available to us in an amount of time, but at least the preliminary assessment and some of the papers and evaluations assessment of this critically in the medical literature have not shown that there's compromise to the babies through it, and that moms don't get sicker in pregnancy if they do end up getting COVID. That was another thing. If you're pregnant, you're immune compromised, and therefore you'll have a hard time in pregnancy and you'll end up in the ICU. That is not what has panned out after looking at it critically from a scientific perspective. And therefore, we're not feeling worried about continuing to create pregnancies through this time.
Yeah, that's really reassuring. Jason, do you have anything to add to that?
Yeah, I think that's really well said. It's interesting the conversations that you have with patients, though, because ultimately it goes back on to them to make that decision. And I would be really interested in knowing, and I don't think we really know this, what proportion of patients are actually deferring treatment because of their concern about COVID, despite the reassuring information we have so far. It'd be really interesting to know that. And part of that conversation then is, well, there's patients will say, well, I'm thinking about maybe waiting until we know more, or until we get a vaccine or something. But the issue is that we just don't know when that's going to be. So when are you actually deferring to? What time are we talking about? A year, 2 years, 3 years? Some people postulate, there'll be breakouts for many years to come of COVID. So it's really hard decision making for patients. I can appreciate it because we give them this reassuring information, and we're available to care. We're helping people get pregnant, but ultimately the decision falls on them. And in my experience, most patients are going ahead, but I would suspect there's a large number of patients that don't reconnect with us and are just kind of waiting it out.
Yeah, that's a great thing to note, Jason. I'll take notes of that, and
we should have a poll. That should have been.
We should have a poll. That would be interesting.
Yeah. That would have been good.
I mean, you kind of did ask that with one of the questions about, I do feel comfortable moving ahead, and I think the vast majority of people did. But a lot of people that won't connect with us, they're just waiting it out.
And we have presentation bias, right? The patients who want to go to care are knocking down the door and saying, like, let's get going. So the patients that we are seeing are already selected out, right? We would need a broader map to count.
Absolutely. I agree.
But it's really, the other thing to say, maybe it's really fortunate that the data is so good it's so good in pregnancy so far, because, you would anticipate it would be much worse, that pregnant women who get illnesses often experience them worse because of the immune system changes that happen in pregnancy. So it is very nice that there is reassuring data out there. Otherwise, it'd be a completely different world for our patients.
We'd be freezing off. We wouldn't be doing it.
Yeah, we'd all be kind of freezing embryos and sitting on our hands waiting.
I agree. We have a question that's come in from one of our viewers. Are there new procedures in place for surrogates and intended parents during this time? I think this is a really important thing to touch on. We were hoping to have a transfer via surrogate in September. Should it be a concern or a reason to postpone? Go ahead, Marjorie.
So it depends, right? So because we have, that's my dog, it's COVID. So the risk is that if they have to travel internationally, and part of our screening protocol says if you've traveled outside of Canada, then you can't be admitted to the clinic without a quarantine, etc. So that might impact it. But September is months away. And as I said, this has been an evolution. So there's a big unknown in the what do we do about this, right? I don't know what that's going to be, but we do have local gestational surrogacy egg donation journeys that are still ongoing. I transferred into a gestational surrogate. The only issue is because we are not, we're having distancing and we're not admitting partners or additional people into the clinic, whereas before it was this, we talk about we can't hug people. It's that whole thing, we can't focus on that patient-centered experience anymore because we can't have all those people in the room and around. So right now, when surrogates are coming, we've adjusted our operations such that they can FaceTime or whatever video chat. It doesn't have to be Apple, but so that they can actually have intended parents present, maybe their partner present. I've had people on something called House Party. I didn't even know that was a thing. But so they had two different people along with the gestational surrogate there, such that we are adjusting to this new electronic, safe inspections in place. But sadly, that would change the experience. So whereas before we could have two dads and a gestational surrogate and maybe her partner, we can't do that. At least not for now. It might change again later. But the travel one is the big one. And I interestingly was speaking with a family lawyer who specializes in gestational surrogacy. And she was saying initially when this happened, she was stuck in the how do we get babies to their intended parents who can't travel? And how do I get their citizenship and organizing all of this stuff while the borders are closed? So new problems arose, but now they have been managed. And we recognize that most things can be managed. We just have to anticipate a different process. So if you're okay with changing the process, we can manage the delivery of care, maybe a little bit longer, but we'll get there. If you don't like change and you don't feel comfortable without having that warmth of people around that you can see, feel, touch, then wait a little, because we're not there yet.
Right. Jason, did you have anything to add to that one?
Yeah, it sort of speaks to that whole thing about COVID, which is that nothing stays the same. And every week things change. Jurisdictions change, access will change, everything is changing, and we're always trying to in flux. So what's the way to move ahead today is not the way that it'll look next week. Mm-hmm. I will say, though, to emphasize that not having friends and partners and other people in your life around through your treatment is very, very different. And it goes very much against our culture, and I think most clinics' culture in Canada, to not have, to not have partners and friends and other people there, support people there, is a real change. And it's a real loss, actually. And I look forward to having that kind of community around patients again.
I agree. I think that's it's such an important piece of the puzzle, and it's it must be very difficult for patients right now to experience that. I have one last question before we start to wrap things up. But what happens if there's a second wave of COVID? Have the physicians across Canada started to? I'm sure that there's been conversations, but I'd love to know what the talk is and what the plans are in case.
I think we're all kind of waiting, anticipating it, but we've gone through the initial wave, and so I think it would probably look very similar. And so we'll probably react to what's happening, whether it was as severe as maybe not as severe. We know the steps involved in wrapping up clinical care. That is, completing the IVF cycles you have going and sort of settling back down to a slower or closed environment again. So we've done that wind down, and now we've done the wind back up. And in the worst case scenario, we have to, shut down for a period of time again. But we know how to do that. We know how to come out of that safely. Again, it would not be easy on patients, of course, but I think people appreciate, it's a pandemic, and we have a responsibility to the patients and the staff and society in general to do the right thing. So I think we will be prepared. We'll just have to react to what we're facing.
Great.
I'd have to say ditto. Like, we know how to wind down, we know how to wind back up. I think what we have discovered from this experience is the critical importance of communication with patients and the anticipatory guidance that we can provide them with, and keeping people in that fold of communicating. We started a new website, social media, we got into TikTok, anything we knew we would share, just to be able to manage that feeling disjointed in and out of care situation. And if we must, hopefully we don't, that was me knocking on wood, hopefully we don't, but if we must wind back down, we will keep everybody in our fold in that TTC community through whatever channels we have, through people like Fertility Matters Canada, just to keep people informed, because that helps to manage that feeling of disconnect and bringing people back, keeping them en français, we say entouré, surrounded, through sometimes the off-putting abyss of not knowing, right?
Yeah. Release. Yeah. We have one last really interesting one. I know I keep saying this because I know we're getting short on time, but this was an interesting one that I saw come in last night, actually. Will embryos that were frozen before COVID be kept separate from embryos created and frozen after COVID? And then the same for the thawing. I thought that was really interesting because it's not something I had considered, and I thought we should touch on it.
What a great question. Again, no one's ever asked me that question. I don't think people are generally quarantining embryos post-COVID at this time. I mean, again, remember, all patients are being screened when they come in. And so yes, there are people that are asymptomatic that are shedding the virus. We know that to be true. But again, we are screening people before they enter. And then in the process, we also know that in the process of washing eggs and washing sperm and making embryos and changing cultures and washing them here and washing them there, that it would be extremely unlikely that a virus would survive that process. And we know from other viruses like HIV and other things that the process of washing and creating embryos mitigates that risk. So, but that's an excellent question.
Right.
So
thank you.
I would say I have been asked that question. We had a very hot debate in Ontario about that question. Okay. And so we combed the literature, and there was nothing really there to say that there was any evidence for needing to isolate embryos. Now, there's patient comfort though. So we know a lot of what we do is managing that uncomfortable feeling of I am out of control in this situation, and you don't really have an answer for me, even though you say it's the most likely thing that I'm fine. So, some clinics are isolating. So they're putting the COVID patients during the COVID time in a separate tank, which is a whole undertaking, mind you.
Yeah.
But, Dr. Hitkari hit it. There's no evidence for antigenicity of washed sperm and eggs, which is why we can manage patients who are HIV positive or hepatitis B positive or whatever, right? So I don't think that it's not something that patients need to worry about, but yeah, some places are still quarantining.
Excellent. Thank you for answering those. So before we wrap up, we have a few more poll questions. We want to collect some data, and we wanted to see, if patients were feeling a little bit different from the start of this session to the end. So we're re-asking this question: do you feel ready to start or resume treatment at this time? And although 90% of you felt ready to start at the beginning of this webinar, I'm hopeful that the same percentage or more are feeling ready after this presentation. Yes, 92%, so an increase. That's lovely. Next question. How do you feel about the measures your clinic has taken in order to protect patients and healthcare workers? So again, this is a question we asked at the beginning, but after seeing the photos and hearing Dr. Hitkari and Dr. Dixon talk about the measures that not only their clinics are taking, but also clinics across the country, we're hoping that people feel, satisfied, really satisfied and safe to head back to treatment. I know there's a little delay. We wait till everybody gets their answers in. %78 satisfied. Great. I didn't write down actually the first thing, but I think that's very similar to the beginning question.
I think it was 80. I don't remember, but I think it was 80.
Yeah, okay. And maybe now maybe we'll have to dig in. We don't know if same people are watching now as maybe people had to jump off. I hope they're not seeing what your clinics are doing and feeling that their clinics are not doing enough. I don't think that's the case.
I don't think so. We're pretty,
I'd say it's pretty, it's very safe across the country in all the clinics. Next question. Has your clinic helped you access resources to cope with the postponement of your treatment because of COVID-19? So we're always interested to know how you feel the communication has been with your clinic, whether that's via email or newsletter or through social media. How do you feel your clinics have been, giving you access to those resources? At Fertility Matters, since COVID has happened, we've really upped our online presence and our online video series so that patients are feeling that they're getting these So this is very interesting.
Yes.
75% of patients don't feel that they had access to the resources from their clinics that they needed to cope with the postponement of treatment. So
Yeah.
that's really interesting, I think. Jason, Marjorie, are you surprised at that? Because I know your clinics are very active in connecting.
Yeah, it's disappointing to see, eh?
It is sad. Like, I think we're trying, but I guess this is why we do these things, so that we can be connected to patients and understand what we need to be doing better. You can't get better without the feedback, and that's a critical piece. So now I get to go back to operations and say, patients aren't feeling like they're getting what we're doing to get them back to care. Maybe we need to think about communicating that in our next post.
Yeah, and again, these are patients from across Canada, so not necessarily patients just at your clinics, but I think it's important for not only clinics and clinicians, but also for an organization like us to say, okay, and how can we help support that from the resources that we're giving to patients to ensure that they feel they might not be getting it from the clinics, but that's somewhere where we certainly could step up and ensure and ask the questions. We can ask the patients, what do you need? So we'll do a follow-up there too, so that, and I'll be sharing that with our clinic members for sure once we do some follow-up with our patients.
I suspect we have to
do a second
wave. I suspect that we have a second wave. I think that in general things will go better. Like, I think again we're kind of learning on the fly on so many different aspects that I think we probably as a community of fertility care providers probably do a better job staying in touch with our patients than we had the first time.
Absolutely.
You know what, if you're trying to come up with literature or documentation and something that we give uniformly, I'm sure I'm happy to help. I'm sure.
Yeah, I think that would be lovely.
We can support you and create something to fill that gap, because that's critical.
Agree. Next question. Do you feel that you can easily get the information you're seeking from your clinic? So do you feel that you're able to connect with the clinic, whether that's via telephone or email, website or social media, to get the information that you need? And of course, lots of people collect and utilize information in lots of different ways. We have lots of patients who aren't active on social media, which is why we've created a newsletter. Or some people may be more active on websites. So it'll be interesting to see this.
I'm hoping. Let's say
Yes, okay. So it would be nice to see that 59%. So 59% of you did say that you can get the information you're seeking from your clinic, which is hopeful, but it would be nice to see that higher than just 60%. I think that would be, you know, for patient access and for patients to feel that they have the information they need to make informed decisions about their reproductive health. I think that's really important, and I think that's something that not only clinics, and again, Fertility Matters Canada can take that information back and say, okay, what is the information patients are looking for? What do we need? How can we support it? And how do I communicate that to clinics so that they can ensure they're able to get that information?
I think that's actually a very good blueprint for that. I think that would be an excellent way to collect that information and the advice. And then Dr. Dixon, I'm sure, can connect the medical directors with FMC and just have that message relayed to the vast majority of clinics in the country, so we can do a better job on that issue.
Yeah, because we, you know, as an organization, we have the patient ear, and sometimes, you know, we're able to collect that data, and it's really important, I think, for the physicians in the country and the patients in the country to connect and have conversations, for the information to go back and forth. So, we've got a project, I think. And last question. Oh, sorry. How comfortable are you with the use of telemedicine? It's really interesting because it's something that we were curious about as we were preparing for this webinar, to say so many clinics are using telemedicine, and how comfortable are patients actually connecting with their physicians, their reproductive specialists specifically, telemedicine. But of course, there are meetings and appointments that can only be done in person. However, if this is the wave of the future, or at least pieces of what this will look like in the future, especially if it can grant access to those who can't easily access clinics, because this country is big and clinics are not.
That's good.
Yeah.
That's good.
So
Yeah.
cool. That's a
that's
great
good. That's
number.
encouraging. Yeah.
That's very encouraging. So for physicians, so for you, Jason and Marjorie, to know that, you know, that's good for you to be able to say, okay, this is working. And how can we continue to use this so that patients feel they're getting the access they need to kind of help them through the journey?
Yep. It's very 2020. Well,
very 2020.
The good part of 2020.
Absolutely.
Like,
yeah, I had a conference call last night on the phone for the first time in 4 months or 3 months, and it was very strange to not see people's faces. I almost didn't know how to interact as efficiently.
Yeah.
I wish we could have teletouch, like, hey,
yes,
without infection, but that'll come later.
That will. That is the wave of the future. So in closing, is there anything that either of you would like to add, or are there any last thoughts before we tie up this session?
I mean, I think it's really good. I hope that the people watching get a feeling that we, as a community, again, work very hard to make sure that their journey through treatment is safe. I'm not really worried about the outcomes and effectiveness. I think that'll remain the same, but we wanted to get back to care and safe care. And I think we worked really hard to accomplish that. And so far, so good, I think.
Yeah, I would agree. And I so, you know, it was called post-pandemic, the new normal. And I think my 10-year-old said it the best. He's like, I know it's supposed to be normal, Mama, but it doesn't feel normal, right? I don't like it. And I get that sentiment from patients too. And so hopefully it's our normal for now, and it will be different and more back to basics in the future. But for now, this is the best and safest way for us to deliver fertility care to our patients. So I guess keep posted. We'll keep you posted, and stay tuned.
And we'll continue to work, patients and physicians together, to ensure that this information is delivered and that you feel confident and that you're getting the information that you need to make these decisions.
Yeah.
We've got a lot more questions that have come in that we just did not have time to answer today. However, I'll be collecting those questions and I'll have them answered, and maybe we'll do an email and answering them through our social media streams. Post in the coming week to make sure that everybody feels that they've had the information that they need given back to them. So Dr. Hitkari from Olive Fertility, Dr. Dixon from Anova Fertility and Juno Groups, thank you so much for your time today. This was very insightful. I appreciate your time. EMD Sorono, who is constantly making sure that we have the resources that we need to help patients get the information that they need. Thank you for your continued support on the webinar series.
Pleasure.
And if you register, you will get the replay in your inbox, and watch for the posting on social media really soon. Thank you all.
Thanks a lot.
Thanks for having us.
Thanks a lot.
Bye.